Hi, my name is Sharon Alexander, and I'm interviewing Rosanna Brown on the Hippa law at the hospital that she works at.
Okay. All right.
Okay, Rose. Can I call you Rose for short?
You can.
Okay. Can you give me a definition of Hippa?
HIPAA is a health insurance portability and accountability act that was introduced to healthcare in 1996. And it was put in place to secure the safety of patients, safety of their information, safety of their care, and it got engulfed in this one act.
Does your hospital have any policy related to HIPAA?
Yes. The HIPAA laws, as soon as each employee is hired into the hospital, they have to sign paperwork saying that they will always ensure patients' safety and their privacy. And there are consequences that they sign off to as well.
Okay. How do you assure that every patient know what their rights are?
Well, each patient that comes in that gets registered into the hospital, they receive a piece of paper stating their rights as a patient and the HIPAA law as well.
Okay.
And they also sign off on that piece of paper that they received it.
Okay, is every employee held liable to know what HIPAA is?
Yes. Each employee, because there's a yearly training that's done that gives update the employees and make sure that they're still up on the HIPAA laws, to make sure that they know the law, they know how to execute the law, and that they do everything in their power to maintain privacy of the patient.
Okay. Can you tell me what is your policy specific to the hospital system?
Specific to the system, the policy specific to the system is that everyone knows, employees and patients, clients and employees all know what the law is and know how to execute it. One of the things that we put in place is to make sure that every person has a password security to the computer. Every employee, when dealing with patients, they have a password safe entry into the computer system, and after a certain amount of time, they're locked out.
Okay. Now, what is the penalty? For employees that does not follow the policy?
Well, first time is a write-up. The second time is it can result in termination.
Okay. Is the employee aware of this penalty?
Yes, every employee at the beginning of the hiring process are initially informed of the HIPAA laws. They get the paperwork, they get the test, and all of that is involved in that.
Okay, how are they made aware?
It's a piece of paper that they get. They are accountable to read the piece of paper. There's a computerized test that they take. They're accountable for taking that test. And in that whole process, it says, do you agree with this or not? And if they agree, the hiring process continues. But if they don't agree, I don't think they'll be hired.
Okay, now tell me this. What are some of the things that your system does to ensure that the patient privacy is protected?
One thing is, like I said, the computers have security codes. The security codes are changed every 90 days. There's a lockout period of 2 minutes if there's no activity on the computer. There's a shredder that's on every unit that you place anything that has patient information on goes into the shredder. Nothing that has patient information on goes into the garbage.
Okay. Now, is there anything about HIPAA that you feel you should talk about?
Well, another thing about HIPAA besides the privacy is the safety issue. HIPAA also states that we have to maintain safety for our patients. So in doing that, safety with like fall precautions, allergy precautions, making sure when passing medications that it's the right patient, right time, and everything. 6 rights for the medication administration, and that all is entailed into the HIPAA. And so that's another thing, another aspect of HIPAA that needs to be known.
Okay. Okay then, Rose, this concludes the interview, and I would like to thank you for taking the time out to answer these questions that I had. And it was good speaking with you.
Thank you.